Many people tell me their health is fine, but when I ask about stress, they tell me it is sky high. So we have got to dig deeper and look at the other symptoms associated with your health. So if you're dealing with bloating or fatigue or mood swings, brain fog, skin issues, allergies, constant colds, that could be a sign of chronic inflammation. And inflammation is one of the biggest, most overlooked factors with egg quality. So in today's episode, we're going to be talking about some blood work, some functional lab testing, and specific strategies you can take right now to improve the chances of pregnancy success and improving your egg quality. Let's go. Welcome back. I'm Sarah Clark, founder of Fab Fertile. For over a decade, my team and I have helped hundreds of couples improve their chances of pregnancy success, whether naturally or through IVF. We specialize in supporting those with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss through functional testing and personalized fertility strategies. Today, we're digging into egg health and what inflammation has to do with your egg quality. This episode is for you as if you're struggling with low AMH, diminished ovarian reserve, poor egg quality. You want to understand how inflammation could be impacting your fertility journey. You're looking for actionable insights to support egg health naturally through lab markers and lifestyle factors. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who's on the fertility journey, please share this podcast with them. Okay, so we're talking all about inflammation, which is that catch-all phrase, but we're going to be talking about it today as it relates to diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss. So, diminished ovarian reserve is the reduction in the quantity and the quality of eggs. It can be associated with aging, but also can happen prematurely. Typically, women with DOR can have low AMH, irregular cycles, poor response to fertility treatments. Premature ovarian insufficiency is what I was diagnosed with, loss of the normal function of the ovaries before the age of 40. It's more severe than diminished ovarian reserve. It can be caused by autoimmune disease, genetics, environmental toxins, or those unknown reasons. But as we dig into functional medicine and functional nutrition, it turns out it wasn't unknown. There's things that can cause it. Recurrent pregnancy loss, 2 or more consecutive pregnancy losses, it can be caused by chromosomal abnormalities, uterine abnormalities, immune dysfunction, and more importantly, egg quality. And the theme here, inflammation, that can worsen outcomes. And so it's important to be able to address that. Sometimes we don't really know what to do to address inflammation, that big catch-all term, but it's important. So for AMH, I've talked a lot about this before. So if you got an AMH of 0.5 to 1 ng per ml, typically they're going to tell you it's diminished ovarian reserve. We're not diagnosing, please bear that in mind. And POI is an AMH of less than 0.5 ng per ml. AMH is thought to reflect the egg quality. It does not test for your uterine receptivity, does not predict your ability to get pregnant naturally. It does not test egg quality, it tests egg quantity. And we've got many people with extremely low AMH, helped someone with AMH of 0.02 at 44 get pregnant naturally. So we don't want to be blind to these numbers, but we need to be able to dig deeper. The inflammation, so chronic systemic inflammation can reduce AMH production and alter your follicular environment. And so the ovary is highly sensitive to inflammatory signals that can disrupt hormone signaling and egg development. And so we got to dig deeper, look at some of those functional labs. I did a podcast episode all on blood work that we're talking about, looking at the optimal range. A lot of times we're told things are normal. You want to make sure they're optimal, and also talking about some of our functional lab testing we're doing. And so let's dig into some of the symptoms that we could be experiencing if we have inflammation. And so maybe you're dealing with that brain fog. You've got difficulty concentrating, anxiety, depression. You've been put on an SSRI. There could be situational anxiety, depression going through the fertility journey, but maybe you have had it for years and they've given you all sorts of medication. You probably tried many things. Maybe you're on an SSRI right now. Maybe you've got that irritability or mood swings. So that cognitive stuff going on. You just want to claw your partner's eyeballs out because your mood's all over the place. Maybe your energy. If you're in your 20s, 30s, 40s, you should be having great energy. If you've got chronic fatigue and you're sluggish and you've got a hard time falling asleep or staying asleep, definitely check out the sleep episode I did all on reasons for that, from blood sugar imbalance to liver issues to magnesium deficiency to cortisol spikes, trouble falling asleep, staying asleep, not feeling rested after sleep. Digestive issues, common but not normal. This could be a sign of inflammation. This could be a reason why the embryos aren't making it, the retrievals are being canceled, why it's not implanting, why you're having pregnancy loss. It's important to keep moving forward because that's your superpower. You're here, you're trying to get some information and you're ready to take action. But we don't want to just keep doing the same thing over and over again, changing the treatment at the fertility clinic. No, we need to be able to work on our health in a targeted manner. So if you got bloating after meals, if you just feel like just so distended and bloated, digestive issues, constipation, you got all those toxins circulating in your body, you need to go to the bathroom and eliminate 1 to 3 times a day. That's normal, not 1 to 3 times a week. Or maybe you got loose stools. I got people telling me they got diarrhea and loose stools for years. Maybe you're not absorbing any of the nutrients. You already know you have food sensitivities. You're like, when I have dairy, I get loose stools, or when I have nuts, they give me cramps. Whatever it is, it's different for each person. Maybe you have eggs and they flare up a sinus issue. So if you got known food sensitivities, you have digestive issues. It's not about you going on this super restrictive diet. We need to be able to address the gut infections, what's going on in there, and then taking out some of those foods for a period of time. But most of the foods, you're supposed to be able to bring them back in. And so we see people just not eating enough. So digestive issues can be a key for inflammation, and maybe things aren't working. Immune system, or you're dealing with pain. So you've got frequent colds. Someone sneezes and you're the first person that gets the cold. Slow recovery, you're like taking weeks to even get back to feeling like yourself. Joint pain, like you shouldn't just crawl out of bed and be in pain. Muscle aches, you're always at the physio or the chiro. And obviously I do the physio or the chiro, and chiropractic care can be great for prevention and also help for fertility as well. But if you're constantly in pain, we talked about this before, she had endometriosis and autoimmune disease as well. And all her retrievals had failed. And when they got married, carried her over the threshold for celebrate the wedding, and her whole body hurt because she was so inflamed. And as she started to address all these gut infections and food sensitivities and work on her stress, the pain went away. And then she had a retrieval, which was successful, and transfer, and had her son. And so she had a lot of inflammation in her body. Headaches. No, we don't just want to keep taking Tylenol, which can then impact the health of your gut. And then that can make things even worse. So your gut health impacts the health of your ovaries. So if you've got headaches or migraines, that's a clue. Something about the corn here in North America, when I go out and it's either the seed oils or the corn, I haven't quite identified it, but I'm pretty sure it's the corn, I get a migraine now. And I do not take Tylenol or anything for it. I suffer through it and use some peppermint oil. And yeah, it's a food sensitivity. So for you, if you've got migraines, we need to dig deeper. Obviously, I've got a whole podcast episode about migraines, which I did years ago, to look at that. But there's hormonal imbalances, but also gut and food sensitivities too. So if you've got a migraine, if you have a history of migraines, you have probably tried it all. But we need to dig deeper, and this could be a clue of why the retrieval, the transfer, the implantation is not working. Blood sugar dysregulation, many podcast episodes on blood sugar, but if you got cravings for sugar and carbs, that could be a sign that things are off, and this is all going to impact your ovulation and the chances of pregnancy success. If you're feeling shaky and irritable or lightheaded when you're hungry, or if your energy is crashing in the afternoon, blood sugar dysregulation can lead to inflammation. Other inflammatory signs, you've got skin issues, acne, eczema, rashes, you've got PMS or painful periods. The period should come should be a non-event, should not be crippled over taking, Midol and all these different medications to help with the pain. Or you already know you have elevated CRP, your homocysteine is out of balance, you've got thyroid antibodies. So those are some other inflammatory signs. Chronic inflammation is going to produce free radicals, and that is going to then impact the health of your eggs. And so they're uniquely vulnerable because they don't regenerate and they've got limited antioxidant defenses. So if you've got mitochondrial dysfunction, I've done a podcast episode all about mitochondrial health. The eggs require energy from the mitochondria to mature properly, and inflammation is going to damage your mitochondria, reducing egg energy and viability. It's going to have that impaired blood flow. That's why it's important. A lot of people do well with acupuncture. It can help with blood flow. It can reduce oxygen and nutrient delivery to the ovary if we have impaired blood flow, and that creates a hostile environment for egg maturation. And then inflammation anywhere in the body is not good for your health and can lead to long-term disease. And so it can age the ovary faster than chronological age, and reducing the quantity and the quality. We can't test for quality, but they test for quantity with the AMH, but we're not looking at the quality of the egg. And you've probably been told you have poor egg quality, and that's why it's not working. And you wonder what you can do. So there's things we definitely can do. So looking at the blood markers, looking at the high sensitivity C-reactive protein, we like it below 0.5. If it is higher, it could suggest inflammation that may impair your ovarian function. You need to get that tested and work with a team. This is something that we do as a team. It's part of our Fab Fertile method. We look at your blood chemistry. We're not diagnosing. If it's high, we want you to go off to see your physician and making sure everything is good from a cardiac perspective. But if it's high, it could signal low-grade inflammation. Homocysteine, did a whole podcast episode about homocysteine. If it's elevated, it narrows the blood vessels, reduces ovarian and uterine blood flow. It can also damage the DNA, interfere with methylation, which is crucial for egg health. We see a lot of people with that MTHFR gene variant, so you need more methylfolate, maybe you need more support with your methylation pathways, but looking at the homocysteine is key. I can't tell you how many people that I see that have elevated thyroid antibodies, and we like the TPO below 10, the TPG below 30, or 0, all the better, is if there's an autoimmune issue, it's attacking the thyroid, and then that can impair fertility, increasing pregnancy loss, and then autoimmunity can trigger inflammation, which can affect the ovaries and the endometrium. If you got antibodies 100, 200, 300, I get people 900 and they're doing a transfer. We've helped lots of people with Hashimoto's lower their thyroid antibodies, get pregnant naturally, or if they do need to go to the clinic, they're getting pregnant, it's working, the retrieval, the transfer, it's working. So we need to be able to reduce inflammation. And if you got thyroid antibodies that are off the chart, that can be a clue. And blood sugar, if you got insulin resistance, so when the cells don't respond to the insulin, the blood sugar stays high, triggering that inflammatory cascade. And it can also be linked with PCOS, but it can occur without PCOS, and that impairs ovulation and egg health. So insulin resistance, that's going to drive inflammation. You want to be looking at your fasting glucose, your insulin, and you want that A1C. And even subtle raises in insulin resistance can raise inflammation, oxidative stress, and hormone balance. So if your blood sugar is on a roller coaster, you got those mood swings, you've got poor sleep, or if you're feeling hangry, those could be clues that you've got blood sugar issues, and that can increase pregnancy loss. So you need to work on nutrition and movement. And maybe sometimes you need a supplement like myo-inositol, but we need to be able to not just supplement this piece, we need to look on the diet and lifestyle. And a lot of times stress can then impact your blood sugar as well. And so thyroid health, done many podcast episodes on this. Don't just look at the TSH. That's not looking at the full picture. We need to look at the full thyroid panel, looking at the free T3, the reverse T3. And so making sure the TSH, if it's below 2, your REI is going to want that. If it's higher, then that could be linked with poor ovulation and pregnancy loss. And if you've got antibodies in there, that can impact the health of the ovaries and the uterus. And if the reverse T3 is off, then that can be linked with inflammation, and that can impact the health of the eggs. And obviously, if you have a thyroid autoimmune issue, thyroid dysfunction is really going to fuel systemic inflammation, and you're just creating a vicious cycle here. So if you have a known thyroid issue, we have got to dig deeper. Typically 100% gluten-free, looking at gut infections, working on the stress, and digging deeper as to why the thyroid's off. Nutrient deficiencies, we see this a lot too with people just being low across the board. So vitamin D, low, it regulates your immune function and inflammation. So if it's low, we see a lot of people with low AMH and low vitamin D. We like it between 60 to 80. It can support hormone balance. We need to see, why is it low? Maybe you have that gut infection and you're supplementing all day long, and maybe that's why the retrieval, why the transfer, why the pregnancy loss if the vitamin D is low. Vitamin B12 and folate, it's key for methylation and the DNA to repair the eggs. if deficiencies are going to raise your homocysteine levels and oxidative stress. Again, that's why we do some of this genetic testing. We use the Grow Baby test, and we have access to these tests. We ship them worldwide. It helps to improve pregnancy outcomes, prevent gestational diabetes, prevent preeclampsia. Maybe you need support with your methylation, and there's things we can do to support that. Sometimes people have a high B12. So we like B12 between 800 and 900. Maybe yours is high, but it's falsely high. It's actually low. You're not absorbing it. So we need to look into all the markers here. We don't diagnose. We look at patterns and themes to be able to then make changes. Zinc and copper, it supports the antioxidant enzymes. Copper balances zinc, but excess copper can cause oxidative damage. So we need to be careful we don't throw one thing out of balance when we do our hair tissue mineral analysis tests. Ferritin, iron deficient. We see a lot of people that are anemic. So iron deficiency, and we see the thyroid and iron correlated a lot. Iron deficiency will impair ovulation and promotes that oxidative stress. And so we need to look at these different nutrients and then be able to make some targeted changes. Also looking at your lipid panel. So looking at your cholesterol. So it's a lot of times people's cholesterol is too low. So it's needed for sex hormones. You need to have adequate cholesterol to make your hormones, your estrogen, your progesterone, your testosterone, and low can impair your hormone production and be linked with the inflammation. And the triglycerides, high levels can reflect insulin resistance and metabolic inflammation. So sometimes 2 years or more beforehand, if your triglycerides, we like them between 70 to 80. If they're high, then that can indicate something's happening with blood sugar. So again, it's all connected. We need to dig deeper, be our own advocate here, and make some targeted changes. So I feel like a broken record on this one, but we're going to be working on some of those lifestyle and environmental contributors of inflammation. Gut health. Talked all about gut health. If you've got a leaky gut, that can then release toxins into the circulation, trigger inflammation. Your body mounts an immune response to your favorite foods because you have gut infections, lets in all these pathogens. Gut dysbiosis can be linked to autoimmune disease and hormone imbalance. Stress, the elephant in the room. If we have got chronic stress, the chronic stress is going to activate that HPA axis and raise cortisol and inflammation. Poor sleep, it's going to increase oxidative stress and inflammation. So it's not just about taking more sleep aids and pounding down more melatonin. Why is your sleep off? I've done a whole podcast episode on that where it talks about magnesium deficiency, liver detoxification, your blood sugar, your adrenals, cortisol spikes. Why is your sleep off? Toxins. We're all exposed to these environmental toxins like phthalates and BPA, and that's disrupting your hormones and can increase inflammation. And so you want to have that diet rich in antioxidants, eating the rainbow, eating lots of veggies, having lean protein, wild caught fish, grass-fed meat, organic poultry. And depending on your blood sugar, you can use a CGM blood sugar monitor, continuous glucose monitor, or a glucose monitor. You can just get at Walgreens or CVS and check your blood sugar after you eat. And so maybe you can have some sweet potatoes, or rice. And you want to have, after each meal, go for a walk. It's interesting. This is part of my routine. And then yesterday, the dog is with my husband up north. I'm here at my daughter's place. And I had my dinner and I'm like, oh, I don't have a dog to walk. And there's no husband here to walk with me. And my body was like, I ate and I had to get outside. It's like, let me outside. I need to move. And so just make it part of your routine and really avoiding those toxins as much as possible, going toxin free when you start avoiding them, and you can let them back in, plastics, or you smell any of those chemicals. I just personally can't tolerate them anymore. They're horrible. At a minimum, kick out the stinky candles and don't have those plugins. Okay, so some testing. So you want to look at the CRP, look at your homocysteine, check the full thyroid panel, including antibodies, look at your glucose markers, consider the functional lab testing, looking at a stool test, looking at your gut health, looking at food sensitivity testing, looking at genetic testing. So then we can look at, you need more methylation support, looking at the full thyroid panel, supplements. So our foundational supplements, we do a methylfolate prenatal, we do CoQ10, we do omega, do vitamin D3K2, we do magnesium glycinate, and we do a probiotic. Maybe you need more methylated B vitamins if your B12 is off. So the rest of it, you need to do it from a targeted manner. Otherwise, you just take a boatload of supplements and not sure why you're taking them. And creating a personalized plan is important. You want to work with someone who specializes in fertility. We specialize in low AMH and high FSH, DOR, POI, and recurrent pregnancy loss. And so I can really peek around corners and look at themes here. It's not just one marker and then we hang our hat on it and say, oh, there's nothing we can do, such as the AMH. And so it's making those targeted diet and lifestyle changes to actually improve the chances of pregnancy success, reduce inflammation, and get the body in the best shape as we prepare to have our child. And so if you've got inflammation, it could be a reason why you have poor egg quality, the reason why you're having pregnancy loss. So get the testing and then be able to make an informed decision. A lot of times if we go to the REI, they diagnose you with DOR or POI, they tell you have recurrent pregnancy loss, got that low AMH, and next thing you're doing a retrieval, a transfer, and then the embryos aren't making it. You had them all tested, they're all abnormal. Maybe you have one, and then you just feel very pressured and you're on this path of medication. So you don't have a medication deficiency. There's something happening in your body. And if there's inflammation from all those different, if you've got any of those symptoms, it can be an indication of inflammation from a cognitive issues. Let me just recap those. If you've got digestive, mood issues, energy, immunity, any kind of pain, blood sugar, if you've got skin issues, that could be a key that there's inflammation going on in your body. And so if you wanted to book a call, you just go to hello@fabfertile.ca, do subject line fertile, and we will get our eyes on your specific situation and help to improve pregnancy success. Thanks for listening. Take care.